Your alarm screeches at 6:45 a.m. You blink against a haze of sleep, roll to the side, plant your feet on the floor, and bend forward to pick up your phone, or maybe the socks you tossed off last night. Within seconds, your lower back whispers, or sometimes screams, a familiar complaint. You dismiss it as age or stiffness, or I just slept funny. But what if I told you that exact motion is secretly setting the stage for more intense back pain, not just today, but for months or years to come? Millions of people start their day by unintentionally wrecking their lumbar discs in the first 5 minutes out of bed. It's not because they're lazy, weak, or doing deadlifts with bad form. It's because they're performing a completely natural, everyday motion, bending forward, at the worst possible time from a spinal health perspective. And no one ever taught them otherwise. Let's walk through why. When you sleep at night, your body takes full advantage of being horizontal. Your spine is relieved of gravity's constant downward pull. Tiny sponge-like structures between your vertebrae, called intervertebral discs, act like shock absorbers. While you're lying down, these discs rehydrate, pulling in fluid like thirsty little jelly donuts. This is how you actually wake up slightly taller than when you went to bed. If you measure yourself at night versus morning, the difference can be as much as 2 centimeters, about 3/4 inch. Sounds like a good thing, right? Well, yes and no. These water-plump discs are healthy and necessary, but they're also more pressurized and vulnerable to compression stress first thing in the morning. When you immediately bend forward, whether it's to tie your shoelaces, pick up your phone from the carpet, load the dishwasher, or even just lean over the bathroom sink to wash your face, you suddenly squeeze those extra hydrated discs in a way they're least prepared to handle. Scientists like Dr. Alf Nachemson and Dr. Stuart McGill have studied this phenomenon for decades. Nachemson's classic pressure studies placed tiny sensors inside human discs and found that simple forward bending increases disc pressure by 2 to 3 times compared to standing upright. When discs are freshly swollen with fluid, that internal load skyrockets even higher, putting micro cracks in the tough outer rings called the annulus fibrosus. Over time, repeated microcracking creates weak spots where disc material can start to bulge or herniate outward, eventually pressing on nerves and lighting up your leg with sciatica. So while your early morning toe touch or bend to grab the toothpaste might feel innocent, it's often the final straw in a chain of accumulated stress. Ever hear someone say, "All I did was lean over the sink and my back went out"? This is exactly how it happens. Their discs were already pressurized and vulnerable, their muscles still half asleep and unengaged, and that sudden forward hinge loaded the weakest link. Pop, here's a cruel irony. Your body feels stiffest in the morning exactly because of this overnight rehydration. As the discs plump up, they slightly stretch the ligaments and capsule around your spinal joints, creating a feeling of tightness. It's not that your muscles are screaming for a stretch. It's that your discs are literally fatter, creating a gentle traction that your nervous system interprets as stiff. The mistake people make is try to immediately flex forward to relieve that stiffness, thinking, "I'll just stretch it out." But that stretch is actually the riskiest move you could pick, right when those discs are swollen, and their collagen fibers more prone to microdamage. It gets worse when you pair that early forward bending with poor muscle activation. After 6 to 8 hours of stillness, your stabilizing core muscles, the multifidus along your spine, transverse abdominis in your belly, and deep hip rotators, are essentially on sleep mode. They're not fired up yet to protect you. So the second you bend, it's largely your passive spinal structures, the discs and ligaments, taking the load. Without support, the intradiscal pressure is concentrated instead of evenly cushioned by an engaged muscular brace. So, what does this look like in real life? You wake up, swing your legs off the bed, immediately hunch to grab your phone from a nightstand shelf. You shuffle to the bathroom, lean your upper body over the sink with a rounded back to spit toothpaste or wash your face. You stoop to pick your shoes from under the dresser or to pet your dog, or you bend over to scoop up the laundry basket, completely unaware your spine is still in its most fragile morning state. It all feels routine, harmless, yet these are the exact harmless rituals that silently carve little faults into your lumbar disc walls, setting you up for the day when one small movement is all it takes to cause a sharp, incapacitating injury. If you're reading this thinking, but how dangerous can it be? I've been doing this for years and I'm fine. Remember, discs degenerate over decades, not overnight. It's a cumulative loading problem. The damage adds up silently, like tiny cracks in a bridge that eventually gives way under a perfectly ordinary truck. Your spine doesn't get a memo that says, "Warning, 2 more bends and you'll rupture L4, L5. It simply fails when the threshold finally exceeds your tissue's resilience. That's why athletes who deadlift 400 pounds without issue sometimes throw out their back picking up a sock. The load on the disc isn't just about the external weight. It's about internal disc pressure, hydration state, position, speed, and whether stabilizing muscles are awake and firing. Right after getting out of bed, your internal conditions are primed for injury, even if there's hardly any weight in your hands. This is a secret sabotage most people never learn, because no one ever taught them how discs truly work. You get endless stretches for tight hamstrings, ergonomic chairs for desk jobs, foam rolling videos on Instagram, but almost no fitness influencers, physical therapists on YouTube, or even family doctors talk about the first 10 minutes after waking up as the most vulnerable window for your lumbar spine. They miss the when focusing only on the what to stretch or strengthen. Yet timing is everything. So tomorrow morning, instead of mindlessly folding forward like usual, we're going to arm you with smarter strategies. We'll show you gentle moves that wake up your stabilizers, decompress your spine, and let your discs slowly normalize internal pressure before you ask them to handle forward bending. We'll also give you tiny posture hacks, like how to brush your teeth or pull on socks without putting your discs at risk. In the next section, we'll dive deep into the hidden biomechanics of the morning spine, explain exactly why your discs are taller yet more fragile, and break down the research from spine biomechanics pioneers like Stuart McGill. Because once you see the MRI comparisons of loaded versus unloaded discs and understand what's happening inside your spine minute by minute after you rise, you'll never look at your first movements of the day the same way again. Stick with us. By the end of this video, you'll transform the most dangerous minutes of your day into the safest, giving your lower back a fighting chance to stay strong and pain-free for decades. Part 2, why your lower back is so vulnerable in the morning. Let's zoom in on the hidden world inside your spine, the secret environment that makes your lower back uniquely fragile first thing in the morning. Because once you understand this internal biology, you'll never again think that bending over to grab your slippers right after getting out of bed is no big deal. 1. The overnight transformation of your spine. Every single night while you're sleeping horizontally, your spine does something remarkable. It rehydrates. Picture your spinal discs, those jelly-like cushions stacked between each vertebra, as little water balloons. During the day, the constant downward pull of gravity plus the weight of your head, shoulders, torso, and anything you lift all compress your discs, slowly squeezing water out. That's normal. Your discs act like shock absorbers, protecting your vertebrae from direct bone-on-bone contact. By bedtime, after 16 hours upright, your discs have shrunk slightly. This is why most people are about 1 to 2 centimeters, 0.5 to 0.75 inches, shorter at night than they were in the morning. But then you lie down. With the spine finally horizontal, gravity's compressive effect eases, and like a sponge dipped in water, your discs start pulling fluid back into tiny porous channels. By morning, they're plumped up again, taller and rounder. Refreshed keep supporting you for another day. It sounds wonderfully restorative, and it is. This nightly inflation is your body's natural way of maintaining healthy disc height and spacing for your spinal nerves to pass through. 2. The price of that hydration. A spike in internal pressure. Here's the catch. Fully hydrated discs are also at their highest internal pressure of the entire day. Think of it like this. A balloon filled to maximum capacity is more likely to pop from even a small squeeze. A disc right after waking is similarly vulnerable. It's full of extra fluid, which means the collagen fibers in its outer ring, called the annulus fibrosus, are stretched tighter than normal. This makes them more susceptible to tiny micro tears from bending or twisting motions. Those micro tears often go unnoticed in the moment but accumulate over months and years, setting the stage for future herniations or bulges. That's why bending forward right after getting out of bed, To pick up socks, tie shoes, or even feed your dog can be far more risky than doing the exact same motion later in the day. Dr. Alf Nachimson, a pioneer in spinal biomechanics, performed groundbreaking experiments that literally measure the pressure inside discs during different positions and activities. He found that lying flat on your back exerts the least pressure on your discs. Standing increases pressure moderately. Sitting slumped forward doubles it. Forward bending, like tie your shoes, triples it. And twisting while bending can raise pressure by 400% or more. When discs are fully hydrated, these relative increases produce even more stress on the outer collagen rings. Think about that for a second. Your habit of bending over right after crawling out of bed multiplies internal stress on your discs exactly when they are least capable of withstanding it. 3. Why your back feels so stiff in the morning, and why that's misleading. Now, let's bust a common myth. Most people interpret morning back stiffness as tight muscles that need stretching, so they immediately fold forward to touch their toes or do a deep side bend. But ironically, that tight feeling is largely due to the overnight expansion of your discs. As your discs swell overnight, they slightly stretch the surrounding ligaments and joint capsules of the spine. Your nervous system interprets this as stiffness. It's not your muscles begging for a stretch. It's your ligaments under mild tension because of the plump discs. The danger? By trying to stretch away that sensation with forward bending, you're actually overloading the discs at their most delicate state. Dr. Stuart McGill, the world-renowned spinal researcher, describes this clearly. The morning is when the intervertebral discs are most swollen, increasing bending stresses and risk of injury. Flexion upon rising from bed is particularly problematic. That means your instinct to do a deep morning toe touch is the spinal equivalent of flooring the gas pedal on a freezing engine. You're stressing tissue that isn't ready for force yet. For the hidden role of your sleepy stabilizers, adding insult to injury, the first few minutes after waking, your core stabilizers, the deep abdominal and spinal muscles that protect your back, are not yet firing at full strength. During sleep, their baseline electrical activity drops. They're literally still asleep. So when you immediately bend forward on waking, your passive structures, discs and ligaments, bear the brunt of the movement load, rather than being supported by an engaged corset of muscles. That means the already pressurized discs absorb even more stress. Over weeks, months, and years, this repeated mechanical insult breaks down the microarchitecture of the discs, increasing your risk of chronic morning stiffness that lasts longer each year, disc bulges or small tears that eventually protrude enough to pinch nerves, sciatic-like pain radiating down a leg after you do something as simple as pick up a sock. 5. Why you sometimes throw out your back doing almost nothing. This is why it's so common to hear people say, I wasn't even lifting anything heavy. I just leaned over the sink and my back went out. It wasn't the weight. It was the combination of overnight disc swelling, high internal disc pressure, low muscle engagement, sudden flexion load on sleepy tissue. Add those together, and a harmless reach for a shoe can exceed the tolerance threshold of your annulus. That's when the jelly-like nucleus inside pushes outward, tearing the fibrous ring, and sometimes compressing a nearby nerve. The pop is instantaneous. The regret lasts weeks. 6. The cumulative danger nobody talks about. Even if you don't feel a pop today, these small flexion stresses compound micro-injuries over time. Each time you bend first thing in the morning, tiny structural failures occur at a microscopic level. Over thousands of repetitions, these microfailures merge into macroscopic ones, a process called cumulative disc trauma. By the time you're 45, you might blame aging, when in fact it was decades of bending forward in the first 10 minutes of your day. 7. Setting the stage for safer mornings. This doesn't mean you should avoid bending altogether. It means the first 15 to 20 minutes after getting out of bed requires special care. It's your spine's warm-up period. You wouldn't sprint a cold muscle. You shouldn't hinge a swollen disc. In our next section, we'll reveal the number one morning habit that's quietly doing the most damage. Hint, it's probably something you do before coffee. Show you exactly how it loads your discs under a microscope, and then give you alternative ways to move that protect your spine while still letting you live your life. Stick around. Because learning how to handle your spine's most vulnerable window could be the simplest step you ever take to stop lower back pain before it starts. Part 3. The hidden habit that destroys your lower back. So we've set the stage. Your discs are swollen from a full night of rehydration. They're under the highest internal pressure they'll experience all day. Your stabilizer muscles are still groggy. Your ligaments and joint capsules are gently stretched. And right at this fragile moment, there's one habit almost everyone does, without a second thought. That places precisely the kind of load that damages lumbar discs over time. What is it? Bending forward immediately after getting out of bed. Not bending with your knees or keeping your spine neutral. I mean that casual, unconscious fold at the waist that turns your lumbar spine into a C-shape first thing in the morning. One of the most common versions of this hidden habit. People do this a dozen different ways. You roll out of bed, see your phone charging on the floor, and casually bend at the waist to scoop it up. You walk to the bathroom, lean your whole upper body forward over the sink while brushing your teeth, rounding your lower back without even noticing. You pull open a low drawer to grab socks, bending at the waist instead of squatting or kneeling. You pick up clothes from the floor, half twisting at the same time. Or you make your bed, repeatedly reaching across it with a rounded spine, loading your discs in flexion while they're still superhydrated. You probably never thought twice about these movements. They're so normal, so mundane, but under the hood, your spine is quietly absorbing the price. Each time you do this right after rising, the motion pushes the fluid nucleus of your disc backward against the collagen fibers of the annulus. Fibers are already on high tension from overnight swelling. That repeated microstrain is like bending a credit card back and forth. The first 10 times, it seems fine. The 100th time, it starts to weaken. Eventually, it snaps. 2. Why bending forward right away is uniquely risky. Let's break down why this combination of early morning disc swelling plus forward bending is so dangerous. High internal disc pressure. Overnight, your discs have pulled in water. That means the hydrostatic pressure inside each disc is higher, like a balloon overfilled with air. A normal forward bend already increases intradiscal pressure by 2-3x. On a hydrated disc, that jump is even steeper. Collagen fibers already stretched. The annulus, which surrounds your disc nucleus, is slightly stretched from the increased volume. Imagine wrapping duct tape tightly around a water balloon that's been overfilled. It's under tension even before any external pressure arrives. Minimal muscular protection. Your deep spinal stabilizers, multifidus, transverse abdominis, and even the bigger supportive muscles, like erector spinae and glutes, aren't fully on yet. Neural drive after sleep is low. So when you hinge at the waist, most of the load goes straight to passive structures, ligaments and discs, rather than being shared by active muscle bracing. No warm synovial fluid. The facet joints in your spine have tiny lubricating capsules. After hours of immobility, these are a little stiff, meaning even simple flexion doesn't glide as smoothly. That stiffness can cause small microjolts through the vertebral chain. In short, bending forward in that first fragile window is like doing a max deadlift without warming up, without engaging your core, on a disc that's puffed up and already under tension. No wonder the injury stats are brutal. 3. The research that proves the danger. Dr. Stuart McGill, one of the world's foremost spine biomechanics researchers, spent decades putting human cadaver spines through cycles of bending and loading to study exactly how injuries happen. What he found: spines fail far faster under cyclical flexion, loading than under pure compression. In fact, discs could withstand high compressive forces if the spine was kept neutral, but add repeated bending, especially early in the day when discs were still hydrated, and failure occurred at dramatically lower forces and fewer cycles. Another striking study by Weidman et al. Followed lumberjacks, clerical workers, and truck drivers. It revealed that people who performed repeated trunk flexion early in their workday had significantly higher rates of disc degeneration and herniation decades later, regardless of how heavy the loads were. It wasn't just weight. It was a pattern. Forward bending under unfavorable internal conditions. That means you don't have to be a laborer or power lifter to wreck your back. If your daily routine involves flex first, stabilize later, even if it's just making your bed, you're steadily wearing out your discs. 4. The deceptive comfort of bending forward. Here's one more cruel twist. Bending forward often feels good in the moment. If your back is stiff, rounding over might give a temporary sense of relief, especially if you have tight spinal erectors. It stretches the posterior muscles, reducing immediate muscle tension. That's why people instinctively lean forward when they're uncomfortable. But long term, this is a trap. Why? Because that satisfying muscle stretch also allows the inner gel of the disc to push backward even more freely, deforming the annulus over and over. It's like repeatedly pushing on a bulge in a tire. It may look the same after, but inside, tiny tears accumulate until one day it fails. 5. But I've done it for years. Why hasn't my back blown out yet? That's the deceptive part of cumulative tissue damage. Your discs are incredibly resilient in youth. The collagen fibers can micro-tear and repair. Your hydration gradients are robust. You might bend every morning for years and only get occasional soreness. But these structures have a finite capacity for repeated stress. It's like bending that credit card or bending a thin metal rod. At first, it springs back. Then after hundreds or thousands of tiny cycles, it develops a microscopic crack you can't see. The next bend causes a catastrophic break. That's why so many people report, I didn't even do anything major. I just bent to rinse my mouth, and suddenly my back seized. It wasn't that moment. It was the thousands of previous unprotected morning bends that wore down the disc's internal architecture. 6. The ultimate point. It's not flexion itself. It's when and how you flex. Flexion isn't the enemy. Your spine needs to bend. The problem is flexing at the wrong time, when your discs are at peak internal pressure and your muscles are at minimal readiness. Imagine trying to do your deepest squat first thing in the morning, cold, without warm-up. You wouldn't dare. Yet, people perform full lumbar flexion, rounding the low back, within minutes of waking, with zero prep, multiple times every morning. This is why understanding your spine's morning vulnerability is so life-changing, because you can still do all your normal activities, tie your shoes, pick up your kid, wash your face, but timed and positioned differently, so the load shifts safely to muscles and away from vulnerable passive tissues. 7, where we go next. So now you see it. That casual forward bend in the first 10 minutes of your day is the single most destructive habit for your lower back. Not because it's dramatic, but precisely because it's so normal and repeated. In the final section of this series, we'll arm you with a bulletproof morning ritual. Micro movements that safely squeeze out morning disc fluid under controlled loads. Clever posture hacks for washing up or putting on socks without overloading your spine. And an exact hydration plus gentle activation sequence that wakes up your stabilizers before your first bend. Stick with us, because stopping this silent daily sabotage might be the simplest, most powerful intervention you ever make for your back health. And it starts tomorrow morning. Part 4. How to reprogram your morning to save your lower back. You've made it to the final and most important part of this journey. Now that you know why your discs are swollen and vulnerable each morning, why your sleepy stabilizer muscles fail to protect you right away, and how bending forward first thing is basically asking for a future herniation, we're going to flip the script. This section is your step-by-step morning blueprint, so that starting tomorrow, you protect your spine exactly when it's most fragile, instead of silently wrecking it. 1 the first 3 minutes after you wake up. How to get out of bed safely. It begins before your feet even hit the floor. Most people wake, toss the blankets off, swing up into a partial sit-up, then lean forward to stand. Exactly the flexion pattern that overloads the hydrated discs. Instead, follow the spinal sparing sequence. Roll onto your side first. Keep your knees slightly bent, as if in a gentle fetal position. Use your hands to push your upper body upright. Simultaneously let your legs drop off the edge of the bed, so gravity helps you come up without rounding your low back. Pause sitting on the edge for 10 seconds. Take 2 slow belly breaths. Let your nervous system stabilize. Feel your spine settle. This simple habit, side roll plus push-up instead of jackknifing straight, reduces early morning flexion load by up to 50%. It's the same protocol used in post-disc surgery rehab and for severe sciatica patients because it's the safest known spinal transition from lying to sitting. 2. The next 10 minutes. Gentle decompression and microactivations. Now that you're upright, the trick is to let gravity naturally compress your discs a bit before you start asking them to flex and twist. This controlled settling actually helps express some overnight fluid in a uniform way, reducing risky internal pressures. Your easy micro-sequence. 1. Stand tall with feet shoulder width. Reach your arms overhead. Take a slow inhale, expanding your belly. 2. Exhale and gently reach the ceiling, not forward. This axial stretch lengthens you without rounding the spine. 3. Drop arms. Tighten your glutes for a 5-second squeeze. This stabilizes the pelvis and primes hip stabilizers. 4. Place hands on hips. Do 3 tiny hip hinges. Keep chest proud. Push but back 2 inches and return. This is not a full bend, just a cue to wake up your posterior chain. 5. Finish with 2 deep 4-7-8 breaths. Inhale 4, hold 7, exhale 8. This calms your sympathetic nerves, which tightens spinal muscles. Do this short protocol while waiting for your coffee to brew. In under 90 seconds, you've gently loaded your discs in a controlled vertical way, begun to switch on stabilizer muscles, and reduce the danger that comes from immediately diving into deep flexion. 3. The first bathroom trip. How to brush, wash, and tie shoes without killing your discs. At the sink, instead of bending your upper back over the sink, hinge at your hips with a flat back, knees slightly bent, and place one hand on the counter for support. This shifts load to your legs and keeps your lumbar curve neutral. Alternatively, stagger one foot slightly forward like a fencer's stance, which reduces spinal shear. Putting on socks or pants. Sit on the edge of the bed or a sturdy chair. Cross one ankle over the opposite knee to bring your foot up to you. This avoids a crane move that dumps all pressure on your discs. Brushing teeth or washing face. Keep your spine long. Support yourself by leaning your forearm on the sink or counter edge. Bend your knees slightly. Let your hips sit back instead of your spine rounding forward. 4. Hydration and gentle fueling. The inner cushion fix. Remember, your discs are most hydrated right now, but your muscles, ligaments, kidneys, gut, and overall systemic tissues need fresh hydration to function. Dehydration stiffens fascia and slows the rebalancing of disc fluid. So within 30 minutes of waking, drink 250 to 300 milliliters, 8 to 10 ounces, of water with a pinch of pink salt plus squeeze of lemon. This helps pull water into your extracellular space, fascia, tendons, discs, efficiently. The sodium helps maintain fluid gradients. The vitamin C from lemon helps collagen structures. Pair it with a small handful of almonds or walnuts to provide magnesium and trace minerals that reduce muscle spasm risk. 5. The first hour movement rule. Minimize sustained sitting and avoid early stretching. Your spine is still adjusting. Sitting collapses the discs into flexion. Even worse, slumping on a couch, scrolling your phone for 30 minutes. Use the 20-20-20 rule. Every 20 minutes, stand up for 20 seconds, do 20 slow steps around the room. Avoid deep forward folds or hamstring stretches in the first hour. Save those for later when your discs have settled. If you work from home, do your first email standing at a countertop or at least perching on a stool so hips are above knees, reducing lumbar flexion. 6. Quick. Are my discs ready yet? Test. By 45 to 60 minutes after getting up, your discs have generally expressed enough fluid to be closer to daytime normal. Run this micro-check. Stand tall. Place hands on low back. Gently arch backward 5 degrees. If this feels smooth or slightly stiff, you're okay. If it feels pinchy, clunky, or gives sharp pain, your discs may still be sensitive. Keep movements neutral a bit longer. 7. Building a forever habit. If you integrate these simple tweaks, side roll out of bed, early upright decompression, hip hinges instead of spine curls, supported bathroom posture, early hydration, your spine will age radically better. You'll cut down on the micro tears that build up into herniations. It's like dental care. You wouldn't wait for a tooth to crack before brushing. You shouldn't wait for a disc to rupture before adopting spinal hygiene. 8. How to speak to your doctor if you suspect damage. If you've already felt that pop or your back locks up painfully after a small morning bend, use this clear phrasing to get faster, more informed medical help. Hi, I've been having lower back pain that began suddenly after bending forward in the morning. It's a sharp, constant pain that doesn't change with position. There's no fever or bowel changes. I'm worried because of how it started, and I read about disc hydration issues. Should I be evaluated for a disc injury or nerve compression? This shows you're educated, focus on the right red flags, and helps your doctor zero in on imaging or specialist referral if needed. So, starting tomorrow, your first movements will protect your discs, not punish them. You'll hydrate wisely, support your spine at the sink, hip hinge the phone, stand tall and breathe deep, and avoid mindlessly folding forward when your spine is least ready. Like this video if this gave you one aha moment. Comment below. What's the number one morning habit you'll change starting tomorrow? Subscribe, because next we'll show the 3 stretches most people do first thing that actually worsen disc bulges and the better alternatives. Your spine is about to feel decades younger, and it starts tomorrow morning.